I was given a prescription for a topical medicine and it's causing my skin to get dry and irritated. That's a common problem that we're going to discuss today. Hello, I'm Dr. Arthur Kolsky and I'm founder and medical director of Advanced Acne Institute. And we like to share insights and experiences with acne sufferers in hopes of helping them navigate the path toward clear skin. However, this is only for educational value and it's not meant as medical advice. So today we're going to talk about a very common problem, and that is patients are given prescriptions for various creams and gels and lotions that are supposed to help their acne, but in actuality, it's causing their skin to get very dry and red and irritated and uncomfortable. So what's going on? Well, the fact is that a lot of the medicines that we have to treat acne are irritating to the skin. They have properties that make them very harsh on the skin. And so some people say, well, it must be working. If it's so harsh, it must be getting rid of my acne. But in actuality, that's not the case. Acne is already a condition with a lot of inflammation associated with it. So the last thing we want to do is to make it more inflamed. So there are certain topical medicines. Some of them are, for example, are called retinoids. Retinoids are derivatives of vitamin A, and there are a bunch of different types. And those types of medicines cause a significant amount of irritation and redness and discomfort. Other medicines like benzoyl peroxide, for example, can also cause the skin to get very dry and irritated. And some people have very intense redness and reactions to that medicine. So it's often not very productive to use those medications when somebody already has a lot of inflammation from acne. So in my practice, I tend to avoid those types of things. I tend to use medicines that have a low chance of causing irritation or redness or dryness. And that's very important. So when a patient comes to see me and they're using those medications because a friend was using that, or because their doctor gave it to them, or because they thought that it was one of the most effective options, I explained to them that that's not always the case, and that oftentimes it makes things worse rather than getting better. And oftentimes, if you actually look at the data of for those medicines, the data that show whether or not those medicines are effective, they're very marginal. Some of the data are not very overwhelming. So the fact that you're using something that's causing dryness and irritation for just a small benefit is probably not a good idea. So oftentimes I discontinue those medications and we switch patients to something that's a lot more effective and not causing so much irritation. And the other thing is, when we're using medicines to treat acne, we like to hydrate the skin as well. So we never want to give a medicine, especially one that might have a chance of causing irritation. We never want to use that without also giving something that's going to be a very good hydration for the skin to keep the skin calm and moist. And in my practice over the past month, I've seen quite a handful of patients who have come to see me using some of these types of medicines, and some of them were experiencing very significant acne flares, because not only do some of these medicines cause a lot of intense irritation and redness, but they can also cause acne to get much worse, because part of the inflammatory process makes acne even much worse. And I saw some really severe cases of that just from using some of these topical medications. So the first thing we do is to stop that immediately. We discontinue those medicines immediately, and we tell the patient that we're not going to be using those medicines. And then we go to a different route from what they had come to us using, and we prescribe medicines that are much more favorable from an irritation standpoint, and they help to get to the root of the problem to help eliminate the breakouts, which then in turn eliminates the irritation and helps calm down the whole process. So that's an important thing to consider when one is considering what type of treatment to use. And if you're using one that's causing irritation and sensitivity, we need to address that, and you should discuss with your provider what that means and whether or not it's a good idea to continue, and what you should do if it's causing too much discomfort.